All of us who need birth control want to find the method that is best for us, and every woman has different needs when it comes to choosing a method. To help you make your decision a tad bit easier, I am going to inform you about the Implanon. The Implanon is a thin, flexible, plastic, matchstick size rod. The Implanon measures about 40 millimeters long and 2 millimeters wide. Now let's talk about the procedure, which is fast and not painful. The first step is your consultation. You will have to make an appointment with the doctor that specializes with the insertion of the Implanon. The reason being that in order for the Implanon to work, it needs to be correctly inserted. The doctor will explain the procedure, side effects, and benefits, and answer any questions that you may have. After the consultation, you will then enter the second step, which is to sign the consent form, which states that the doctor has went over the relevant information. You understand the information fully, and you still want the procedure done. The last step of the procedure will be by lying down and putting the arm that you wish to have the Implanon inserted in above your head, positioned at a 90-degree angle. The doctor will then numb the upper inner part of your arm, approximately 2.5 to 3 inches above the elbow, with lidocaine. After about 2 minutes, he will pinch the arm in which he will insert the Implanon that is attached to a needle, which will be placed directly under the skin. Once the Implanon is in place, he will then put a band-aid over the site and tell you not to fondle with the site for about 48 hours so that the Implanon will not come out. The procedure is now done. This only takes about 5 minutes. Though the procedure is easy and the Implanon sounds good, I know that you are wondering about prices. To have the Implanon inserted, the price ranges between $400 to $800, and to have it removed, the prices range between $75 and $150. Now, don't get too discouraged about the ability to pay the procedure, because if you're in the military, it's free. Depending on the type of health insurance you have, your insurance company should pay the majority of the procedure, if not all of it. According to the Organon USA Incorporated, family planning clinics are cheaper than private health providers. How does the Implanon help prevent pregnancy? The Implanon releases a hormone called progesterone, which is produced by the body to help regulate your menstrual cycle. When the body recognizes high levels of progesterone within the body, your body thinks that you are pregnant. It also keeps the woman's ovaries from releasing eggs, which is called ovulation. It also thickens the cervical mucus to make it difficult for the sperm to survive. There are 3 benefits that are very important when it comes to the Implanon. The first is effectiveness. The Implanon is 99% guaranteed for 3 whole years. 1 out of every 100 women per year become pregnant, which is usually a pregnancy that develops within your fallopian tubes. Please keep in consideration, though it is 99% guaranteed that you won't get pregnant, it does not protect against STDs. The second benefit is convenience. Because it is convenient, because you can breastfeed, you are able to become pregnant within days of removal. You don't have to worry about anything falling off or falling out during intercourse or working out. You also do not have to remind yourself over and over again to take this or change that until your 3rd year has come. The third benefit is being discreet. It is discreet because it cannot be seen, but felt only when pressed upon. Since 1998, there have been more than 2.5 million Implanon units prescribed in more than 30 countries. It is a progesterone-only method of birth control. It does not contain estrogen. Implanon does not contain latex or silicone, and it will not dissolve. Last but not least, the most important is to be aware of the side effects. There are 3 categories when it comes to the side effects: normal, rare, and serious. The most common side effect that you will always be exposed to is irregular bleeding, which lasts for 6 to 12 months, and increased spotting. But usually after the 12 months, you will probably not have a period at all, or a period for 4 times out of a year. The rare side effects that you will have are acne, headache, nausea, nervousness, sore breasts, dizziness, change in appetite, and sex drive. The serious side effects that you will have consist of pain within the arms that has bleeding, pus, or increased redness, a lump in your breast, and severe stomach pain. Overall, the Implanon is a wonderful choice of birth control that will help protect you from pregnancy for a total of 3 years. Unlike other birth control, the advantages outweigh the disadvantages. I'm not trying to persuade you to get it, but only to consider it, because it might not even be for you. And then again, it could be. Thank you, and are there any questions?